All right, today we'll be talking about off the charts, how virtual scribes changed my life, with reference specifically to the Nuance product called iScribes. My name is Dr. Ben Barden. I am a board-certified orthopedic surgeon with a fellowship in sports medicine, currently practicing in Atlanta, Georgia, with the Northside Hospital Healthcare System. My practice is really a combination of general orthopedics and, of course, pursuing my subspecialty in sports. And that really means treating the large genre of musculoskeletal ailments, both upper and lower extremity, but also including back pain and a lot of non-operative treatment as well. I've been in practice for about 5 years, and just by virtue of the period in which I underwent my training, both in regards to medical school, residency, and fellowship, it really was kind of the time in this country where many programs, institutions, private practices were transitioning from paper records to the electronic medical record. And so, for better or worse, was part of probably 4 or 5 different transitions throughout that process, throughout that period, which was a unique experience for many, and certainly for me it was slightly different, having come from a previous background in IT technology prior to pursuing my healthcare career. Throughout my training, I was fortunate enough to get married and start a family, and I'm now a father of 2, and throughout my training, I had 2 kids ranging in anywhere from ages of 1 to 3 to right now they're 8 and 6. And so today's talk is really to address how I've been able to integrate this iScribes product into my practice and really help a lot of others integrate it into their practice, primarily to impact patient and physician care, quality of life, efficiency, and from a business standpoint, revenue integrity and ethical and detailed chart documentation. Let's go to the next slide here. So I think many of us in the orthopedic field would say that clinical documentation in many ways is a burden to our daily workflow, that the content and sheer vastness of that content generated on a daily basis, and even a simple encounter note is full of content that really doesn't contribute to our ability to impact patient care. We're primarily looking at a previous exam, our assessment, and our plan, and yet the amount of data entry is huge. The amount of data entry that is now being required by CMS for certain quality measures is time-consuming, and in some cases that burden is placed on the physician, and in some healthcare environments that burden is placed on physician extenders and medical assistants. Regardless, it makes for a pretty lengthy process in terms of documentation in electronic medical record. It takes time away from patient care. It takes time away from personal interests. It takes time away from friends and family. And so one of my primary interests in pursuing iScribes about 4 to 5 years ago, and my continued interest and commitment to the product, has been how this product has impacted all of those factors. Perhaps the greatest toll it took on me was my work-life balance. As a father of 2 young children, happily married, trying to give them as much opportunity as possible, trying to fulfill a strong sense of duty to be there for my wife and be there for my children, I felt like I was having to compromise that. And you say, well, how does a work EMR documentation system compromise one's marriage and one's relationship with their children? And it did it simply by requiring so much time out of work to document that I was missing out on important milestones in my children's lives. So, for example, a big thing in healthcare right now is access. Part of that is wait times, and I think one of the best things we can do to be competitive, especially in a competitive marketplace like Atlanta, is to have reduced wait times. Irrespective of your talent as a physician, wait times are very much correlated with patient satisfaction. And so my general practice is to go see a patient and not have to perform documentation tasks in between patients that would add a potential 3, 5, 7-minute wait time in between patients. And my practice when I was using the voice-to-text translation software was that I would see a patient, I would write down a bunch of notes, oftentimes having to break eye contact to make my notes, so that later that day, or more likely later that weekend, I would have enough notes available to me that I could go into the EMR, I could utilize the voice-to-text translation software and begin dictating with all the additional tasks involved, dictating period, paragraph, punctuation, next paragraph, all caps on, all caps off. And in a successful young practice, that meant I was taking home about 120 charts a weekend, having call commitments every other night or evening clinics every other night. There simply wasn't time to dictate, and so it would accumulate on the weekend. Well, if you do the math at 120 charts and anywhere between 3 to 7 minutes to dictate an adequate chart, I could spend upwards of 10 to 14 hours dictating over the weekend, manually clicking into each text box, the history of present illness, the exam, the assessment and plan, the x-ray read, correcting errors, and quite frankly, because there were so many errors were left behind simply because the time value wasn't there to go back and correct the error in order to have a grammatically correct note. I just had to simply move on and accept that kind of lesser quality of note. It also meant, quite frankly, in the personal life, that I was hiring babysitters to help take my kids to birthday parties. I wasn't seeing them till later in the day. During the week, it meant that MRIs that were pending clinical assessments for medical authorization with care providers were at times being delayed because although the order had been submitted, they were waiting on clinical documentation, and it was taking several days to turn that clinical documentation around to justify the MRI, which in some cases meant there was some delayed care in terms of patients being able to achieve that MRI. And it really became a major source of anxiety for me because the patient care component, because the family component, that even when I was doing something with the family, I knew I had 100, 120 charts hanging over my head, and it really started to take away from my quality of life. And it was right around that time, thank goodness, that I became aware of the iScribes product, and probably in the beginning didn't appreciate how much it would impact my life, but certainly now that's what I speak to. So let me tell you a little bit about what the iScribes product is, how it works, and then maybe explain to you how it's added great value both in my medical practice and in my personal life. So fundamentally, iScribes uses pre-existing consumer technology like an iPhone, an iPod, a smartwatch like a Pebble Watch or an iPhone watch to give you a highly effective recording device. That's basically a fancy recording device. There's no need to wear any type of lapel mic or carry around a handheld MP3 recorder. This watch resides on your wrist, and the microphone, which is essentially right now utilizing iPod technology, goes in your white coat pocket, in your pocket, or in my case, I'm often wearing scrubs. It clips right in the V-neck of my scrubs and allows the microphone to capture pretty much all ambient sound in the room. So it uses recording technology utilizing the iPod, and the watch component is really a convenient start, stop, pause portable mechanism so that you're not having to take your eyes off your patient to address a phone, but you can simply reach down to your wrist and decide when you want to play, pause, or even expedite a recording. That recording is captured locally on the iPhone or on the iPod, regardless of internet connection at that time. And when you hit stop, it is immediately uploaded to the Nuance servers via HIPAA-compliant channels. And again, my experience with this at multiple institutions is that the back-end technological component of iScribes, which really isn't the physician worry, but oftentimes is the worry of overseeing regulatory bodies at our healthcare facilities, is that this process and this back office area, if you will, has been vetted and is used at some of the most prestigious institutions in the country, such that there's rarely any type of IT issue regarding security of the product. It's an encrypted file. Once it does have internet access, it's uploaded in an encrypted manner to the Nuance server, and from there it's delivered to a scribe. And when I say scribe, this is not a text-to or a speech-to-text software application or artificial intelligence. This is a human being, usually one or two, that have been assigned to you, that have been trained for your preferences, that have been trained on the electronic medical record that you use, both potentially in the outpatient and inpatient setting, depending whether it's the same product or different products, it does not matter. They've been trained and given access to that EMR, and they are immediately given access to the recording. And we can talk about the content of the recording, too, a little bit later, because people use this tool in very different ways. And I certainly know I leverage it in different ways than my partners do, but all of us getting a similar level of satisfaction with different levels of utilization. But bottom line is it is using recording technology that you can be confident is recording in a HIPAA-compliant encrypted way, being uploaded to the Nuance servers where it is then distributed to human beings who are specialized scribes who work with you, especially during the startup process, and we'll talk more about that, to know your exact preferences, even down to how you like your note formatted, whether there's a colon here, a paragraph here, a bolded list, or a number list, exactly what your preference is. And it is transcribed, and perhaps one of the most beautiful things is it's not just transcribed and returned to you in Word document or PDF format, it is transcribed into your EMR. So let me say that again. So you see the patient, the encounter is recorded, that encounter is uploaded with or without commentary from you. The scribe then takes that data and imports it into your EMR. So in theory, you do not need to go into your EMR. And the EMR traditionally is what slows us down and takes us away from patient care. Ultimately, within about 36 hours, that note in your EMR is ready. And really, I'm going to explain, and at least in my practice, the only 3 reasons I go into the EMR. Number 1 being I'm going in to review the notes from the previous day that have been transcribed for me by my scribe, of which 2 have been dedicated to me and know exactly my preferences and how particular I am about capitalization, about list management, that type of thing. And I basically sign it, I review it, and sign it. I have such a level of trust now with my scribes. In fact, they're able to produce a note that is better quality than mine in terms of the amount of spelling errors I would normally produce or grammatical errors I would produce, that oftentimes I am simply scrolling down to the bottom saying sign, save, next, sign, save, next, because I've developed that level of trust in my scribes. One of the key things is that, and it's a key thing to make sure that oftentimes our healthcare organizations know, is these scribes are not performing the exam. They are documenting your exam as you've listed it. They are not making medical judgments. Some of the IT professionals struggle with this concept. The scribe is not making medical judgment. They are taking the content from your encounter with your patient, and they are doing the labor of clicking in the HPI, clicking in the review of systems, clicking in the exam, clicking in the x-ray read, clicking in the assessment, clicking in the plan. And you have the final say if that note goes into the chart. And so the liability still relies with the physician, but the work burden now resides with the scribe. Let me talk a little bit about my life with iScribes. And let's start at let's do the very beginning. So when you decide to make a commitment to this product, iScribes has a wonderful onboarding process where they literally put talent on the ground. When you do make a commitment to iScribes, though, you do have to be prepared that there may be a slight delay until you are set up. And that's because you're not being plugged into a simple voice-to-text application that's done remotely. You are being plugged into orthopedic scribe talent. They have specialty-specific scribe talent. And quite frankly, that talent is currently being trained and assigned. And as the company grows and more physicians, specifically orthopedics, recognize the value of iScribes, that means the organization has to hire and train more scribes. And so oftentimes when you sign on with iScribes, there may be a 1 week, a 2 week wait, sometimes longer, as they obtain talent that is right for you, that they can allocate to you as dedicated scribes. One of the wonderful things about iScribes is there tends to be very little turnover with scribes, which means once you go through the growing pains, if you will, of having a scribe learn your preferences and learn the voice and tone and how much objectivity and how much personal tone you would like in your encounter note, those people tend to be there for a while, and that's a very sustainable relationship. And so it's important just to recognize if you decide you want it on a Monday, well, you may not have it on a Tuesday because iScribes is actually working to find you human beings to be dedicated scribes, and there can be a couple-day or a couple-week delay in obtaining that talent. I would tell you, in my experience, it's been absolutely worth it. I have never had a scribe assigned to me over the last 4 years that I didn't think was absolutely fantastic. So going back to the beginning, it starts with the onboarding process where you say, hey, I want iScribes. They say, okay. They put someone on the ground that comes to the office with you after they've found talent they can, scribe talent they can allocate to you. And they literally work with you. They are not invasive. They're primarily there to see your workflow, make sure the technology they give you is functional, meaning the iPod and the watch And they give you redundant equipment, which is primarily, I think, to prevent user error, which on my case is usually I left my iPod out of the charger and I've got a dead iPod. The nice thing is they provide you with two, and so that doesn't disrupt my workday. I just fire up the charged iPod and I'm ready to go. And they're working live, either via text or via phone, with the two remote scribes that have been assigned to you as you go through the workflow, as they see how you interact with patients, as they see your documentation formatting, how you collect the data, how you enter the data, how you interact with that particular level of enterprise-level EMR or small business EMR. They are there on site working remotely with your scribe to kind of figure out you and your way. That being said, you say, well, the scribe is remote. Well, where are they? And the truth is it doesn't matter. They're all over the country. They work all different types of hours of the day, and bottom line is within 24 to 36 hours, your charts are ready for review because no matter where you are, as soon as you obtain internet connection, your encounter is uploaded, and wherever they are and whatever their work schedule is, they're able to bring it down in an encrypted manner and access your EMR remotely. They are given EMR access just like they would any other employee or extender, and so in terms of maintaining IT integrity, if you will, they are treated like a user, just like any other user, and the files they access are captured by the EMR, and so some administrators have expressed concern about giving outside scribes access to the EMR, but the truth is it's no different than the access we give our vendors that provide us with our equipment and need chart access to justify charges and billing for Medicare-based equipment. And so they're given similar accounts, and those accounts are set up ahead of time before this training day. They come, and within 2 or 3 days, you basically get to know each other. The notes that they then submit for your review, for the first couple of weeks, I read them very intently, making sure things were how I wanted them formatted. If I did have a problem, I always had 2, if not 3 point of contacts that I could discuss those changes with, and those changes were implemented right away. In my case, I was fortunate that I had used another Nuance product, Dragon, for several years. It had a very large file of personal commands and templates that had been very powerful in multiple healthcare settings using the Nuance Dragon system. But the lovely thing is I was able to export my Dragon commands and templates, which there were several hundred, everything from physical exam templates to workers' compensation rating templates, and export that to iScribes and build a iScribes database, if you will, of templates. And just like I would call a power command in Dragon, while utilizing Dragon, I was able to reference the same command, for example, while talking to my scribe. And so I still remain very template-driven, in part because in the startup process, I gave them all my templates. I should also say that throughout the dictation process, as I say something over and over again and say, hey, I like this. This is how I approach my knee injection. I can, on the fly, tell my scribe, you know what, let the following be a knee injection template. And from at that point forward, my scribe has built a template for me that she can export for me to my records if I like, or he or she certainly has available to them every time I ask them to utilize that in the chart. And so that was my startup experience, and the truth is it's really about 3 to 5 days of transition, and the transition can be difficult for some, it can be harder for others. I think fundamentally physicians are creatures of habit, and charting is uncomfortable enough as it is, such that we have all kind of gravitated to the path of least resistance with whatever charting system we have utilized. And so when something new gets introduced to that workflow, it's just hard to break that habit. And the truth is, once you learn how to integrate and leverage iScribes into that workflow, which ultimately means changing that workflow somewhat, that's the transition, but usually it's well received when you realize how much time you save. And for me, it was about a week because I was not used to having to hit play, record, pause. I was having to click and use Dragon, but after about a week or so, I quickly figured out how it worked. So back to my life with iScribes, within 2 or 3 weeks, it became apparent to me that I would never in my future career take a job without having iScribes available. Because where I used to take home 30 to 40 charts a day, I was taking home 0 charts a day, or just a few that required some personal interest I wanted to do some personal research on, or they were extensive workers' compensation cases that required utilization of an impairment rating book, things that went a little bit more than I was willing to do in clinic quickly. my personal workflow with iScribes and how I was able to achieve a no-chart home policy is that I typically have 5 rooms, usually 3 to 4 of them have patients waiting with wait times less than 7 to 10 minutes in total. And I go in to pick up the chart and I immediately dictate the history of present illness, the pain level, a lot of data that's been collected by my medical assistants into the iPod, which is hanging on in my pocket or hanging in the V-neck part of my scrubs by simply pressing record on my watch and talking in a normal tone, or quite frankly, I'm originally from New York, I speak pretty quickly, and my scribe is able to take that and slow it down if necessary. If not, amazingly, they're able to keep up with how fast I speak. And then I go over to the x-ray machine and I dictate my x-ray read, oftentimes leveraging 30 or 40 different templated x-ray reads, and if there's a change, I just say make a change to this. And ultimately, I'm able to capture all that in about 20 to 25 seconds before I even walk in the room. Now, the HPI data collected has been entered into the EMR. Some of it has been spoken by me into the recording by notes my MAs have taken. But really, the best quality history of present illness comes from the patient. If you'll just sit there for 90 to 120 seconds, they will give it to you. So my typical routine then is to leave the watch in the record mode, knock on the door, enter the patient room, and whereas before I kept the chart in front of me and made eye contact intermittently, the chart goes on the counter, my eyes go to the patient, and I sit down, and they tell me their story. And for the most part, if you let them speak for 60 to 90 seconds, they will give you enough content that you can medically, ethically bill at the appropriate level. And for the most part, for a new patient encounter, for a 99203, a 99204, a common revisit of a 99213 or 99214, if you let the patient just talk to you and tell you their story, the recording will be capturing it. If they need redirection, it's very simple, and you just say, well, what types of things make it better? What types of things make it worse? And as far as the patient knows, you are having a human interaction with them. You are focused on them. There is no note-taking. As far as you're concerned, you can have confidence that the scribe is listening, and the scribe can do things verbatim as the patient states them. You can make that request. But again, remember, these scribes have been trained, and so they are able to take objective data out of a conversation that's been recorded and objectively state alleviating factors, exacerbating factors, previously tried modalities of treatment, previously utilized medications, and do it in a professional form where when you read the note, it sounds rather objective. At the very least, it sounds professional, but it is oftentimes very projective. There are situations where I do want things recorded verbatim, especially when things are related to litigation, or if, quite frankly, a patient makes you feel uncomfortable. I want their request documented verbatim. And you just let the scribe know that when you leave the room, and they will do that for you. So for me, I let them talk. And even though my encounter time, the average orthopedic encounter time is anywhere from 2 to 5 minutes, even though my encounter time is no longer nor shorter than before, the patient perception is that I am there longer because I am focused and I am vested in what they're saying and not at all distracted. So I step out of, I perform a physical examination. That's where I usually hit pause. Some physicians will leave it on and document their exam as they go. Some patients like that, some patients don't. My personal preference is to hit pause and leave the room. And very quickly, in my northeast rapid speech pattern, I will rattle off a physical exam, oftentimes utilizing pre-existing exam templates, for example, a medial meniscus exam template, and maybe tweaking a range of motion or the presence or absence of infusion, and then quickly go into my impression and my plan. And you heavily utilize templates by saying left knee injection template or injection decision template, in which we've talked about the risk and benefits of injection therapy. And I don't have to say that every time because my scribe knows my preferences. My scribe knows my database of templates and puts it in. And quite honestly, whereas I used to walk back to my dictation cubby and add that chart to the pile, my typical routine is as I dictate, I walk to the shredder box. And as I get to the shredder box, usually within 3 or 4 minutes of total recording time, the dictation is done, and the plastic slip folder goes on top of the shredder box, and the encounter data goes into the shredder itself, and nothing ever makes it to my briefcase at the end of the day, which means as a father, when I come home, I get to have dinner with my family. It means as a father of little kids, I get to do bedtime with all the fun that comes with baths and showers and books and songs, and even have some time afterwards to have a little bit of conversation with my wife at the end of of a long day, but bottom line is my weekends are now mine, my nights are now mine, and overall my quality of life is much improved, and it has been that way ever since I've had iScribes. Let's talk a little bit about the value of this concept of a virtual scribe. Sometimes when I introduce this concept to some of my other partners, or certainly to administrators, they don't quite understand the concept of a virtual scribe, and how is that better, in my opinion, better than having an actual scribe follow you in the office. Okay, so for starters, if we recognize that the average orthopedic encounter, especially follow-ups, ranges between 2 and 5 minutes, it is virtually technically impossible for a human scribe who's following you in the office to log into the computer, click into each appropriate field, again, history of present illness, review of systems, exam, assessment plan, x-ray findings, keep up with you, the practitioner, okay, as you are oftentimes distracted by the patient communicating to the scribe, enter that into the chart, close it out at a level that is appropriately documented, both from a clinical care standpoint and also from a billing, revenue integrity standpoint, close the chart out and follow you to the room in under 2 to 5 minutes. It simply cannot happen. And so one of the wonderful things about having a virtual scribe is that I press play and record at my will, and that everything is being documented. It does not have to be real-time data entry. And so if the patient decides to have a long conversation with me about their recent cruise to Hawaii, I simply hit pause and engage in that conversation. That's nothing my scribe needs to hear, although if it is recorded, my scribe is educated and trained and knows that a trip to Hawaii, unless it impacted their knee pain in any way, really doesn't belong in the medical encounter. And when I'm ready to continue on with a more focused exam, I'm able to hit record again. And it really doesn't disrupt a human scribe in any way, because when I hit stop and it gets uploaded, everything is uploaded, and that scribe can piece together the chart at their leisure. And when I say at their leisure, it's usually done in 24 to 36 hours. And I don't have to worry about slowing down my pace to accommodate a in-house scribe behind me. And so basically, I can go as fast as I feel is appropriate in terms of clinical care and patient satisfaction, and I know that all the data I need is getting documented. And I think that's perhaps, especially in orthopedics, that's perhaps the greatest value in having virtual scribes. I will also tell you another great thing about virtual scribes is because it is not real-time scribing, that offers the physician the flexibility of portability, meaning you have a busy day. You don't even want to dictate when you come out of the room. You've got to go from room to room to room because you've got to get to the operating room. And so at the end of the day, you've got 20 charts that you still have work to do. Or in my case, on Tuesday nights, I go to the local high school and I run a training room where I'm treating athletes on site. Okay, and it happens in the evening hours, 7, 8, 9 o'clock at night when my scribe is not working. I can, in the first case, get to the operating room while I'm waiting on my case to start, pull out my iPod, hit record, and start knocking out whatever remaining dictation components I needed for my charts. And the scribe will pick those up and populate them in the EMR for me that night, oftentimes if not the next morning, and it's ready for review. If I don't have an internet connection, that's perfectly fine. I can still sit in that orthopedic operating room lounge and dictate, and as soon as I get back to an internet connection, they will automatically upload and be available for transcription. In the case of my training room situation, where on Tuesday nights I'm there from 6, 7, 8, 9 o'clock at night, sometimes on the football field sidelines late on a Friday evening, I can record, oftentimes in the silence of my car, about an encounter I had in a patient without an internet connection out in the middle of rural Georgia or rural South Carolina. And as soon as I walk in the house and an internet connection is established, that file is uploaded. And that my virtual scribe, when available, will convert that to an encounter for my review. If you have a human scribe following you around, typically you have that human scribe during business hours only. And we know as physicians, oftentimes we are at multiple office locations, multiple environments, whether it be hospital, outpatient surgery center, outpatient offices. In the case of orthopedics, oftentimes we're on the sidelines, we're in training rooms, we're at away games. Having a virtual scribe allows you to go anywhere, anytime, and technically still have access to your EMR through them. The other thing I wanted to mention, which is perhaps the thing I enjoy most about this, is even though EMRs represent tremendous technology, advances, there is still a huge gap between electronic medical records and delivering quality, efficient care. iScribes fills that gap. There are only 3 reasons or 4 reasons I go into my electronic medical record anymore. In fact, on most days, I don't even boot it up because my previous note is printed out for me prior to going to every patient's room. The number 1 reason I said I go into my electronic medical record is to spend approximately 3 to 5 minutes authorizing, signing, and saving the previous day's notes that have been completed by my scribe, which at this point, after a couple of weeks, a level of trust was established that I can confidently sign and save without checking for spelling errors or formatting errors anymore. The second reason is purely billing. If I'm dealing with a fracture, I need to have a fracture code in there with new ICD-10 guidelines associated with that CPT code in order for that to get appropriately billed. The third reason is perhaps to add an addendum to a previous note or to add a code to a previous note. And the wonderful thing is I can open up that note, I can hit record on my watch and ask my scribe to enter an addendum into a previous note. And usually all I have to do is unlock that note so that the scribe can get in there. If you listen to this whole process, hopefully you recognize there's a huge level of efficiency, there's a huge level of quality of life improvement from a revenue stream standpoint, from a revenue integrity standpoint. This product often markets itself as a product that enables you to increase your efficiency to the level such that you're able to have more encounters a day. For the encounters that you do have, you're able to bill at an ethical level, if not a slightly higher level, and do it appropriately where you could not before because you're capturing that much more data points. And that in theory, that money is collected sooner. I can say it's not theory for my practice. With most of my notes being closed within 24 to 48 hours, those bills are dropped within 2 days. And if you ask the Revenue Integrity Department, they absolutely love it. If they look at the quality of the note and see if each level of HPI, assessment, exam, level of complexity meets the level of billing, the answer is always yes, in part because so much of the data is collected by letting the patient talk and the scribe inputting that into the chart. And so I will say that while I agree iScribes has a proven record of increasing your efficiency to the level at which you could potentially increase your revenue and your collections, for me, as a father of young children, the greatest value has been the quality of life. Now, I don't want to overstress that too much because that's my priority. A lot of physicians at different places in their life are still very much focused on revenue stream, maximizing their revenue stream, maximizing their efficiency, and iScribes in and of itself meets that demand in a way no other product can. And I've seen it. I've seen it with my partners. I've seen them able to add several encounters to that day because they are so much more efficient. They're not bringing charts home, but maybe their kids are already at college, but they are loving the fact that they are adding 3 or 4 more encounters that day. And from a financial breakdown, the addition of 2 or 3 encounters that day is actually offsetting the cost of the iScribe service, which when you compare to a traditional transcription service at 10 cents a line, does oftentimes seem disproportionately more expensive. The difference is you are not using a transcriptionist. You are utilizing a orthopedic-specific trained scribe who is engaging your EMR for you so that you do not have to go into the EMR, who is helping you bill at a higher and ethical level, and at a level of efficiency where you're able to add 2, 3, 4, 5 more patients to that day, that encounter revenue offsets the cost of the iScribe service such that you are actually better off in saving money from the traditional transcription services we used in the 90s and early 2000s. And I think that's a wonderful thing. I will just say from my standpoint and my priority as a father and a husband, the most wonderful thing for me has not been my ability to squeeze in an extra 3 or 4 encounters, but my ability to come home with a very light briefcase, with a laptop that probably wasn't even turned on that day because I didn't have to go into the EMR, and being able to sit down and enjoy a family dinner, being able to take the kids up to bed and read a book to them without 120 charts hanging over my head. I simply could not put a price on that. And in my life, with my personal goals and agenda, iScribes has allowed me to have that level of fulfillment in my personal life that, like I said, when I was in contract negotiations with my latest employer, it was a bolded bullet point that I would not accept employment without utilization of iScribe service. The nice thing, when you sign up to iScribes, you're not on an island. So the technology, the client satisfaction, the service is administered at multiple levels. On a daily level, you're receiving that through interaction with your scribe, which does not require text, does not require email. Once you go through the startup process, you will receive a daily email with an update about how many notes were transcribed. Perhaps one of the most wonderful things is the scribe will say, Dr. Barden, I did 27 notes for you today, but on chart number blank, 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 X-rays were done, but you didn't provide an X-ray read. On chart number blank, 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 no history, no physical exam was documented. And so they're doing due diligence and document quality measure for you, and oftentimes I'm going back and filling gaps that I would not have known were there. But that is really the extent of my communication. Once the learning curve of the physician preference is established, usually within the first week or two, I'm not in regular contact with my scribe other than the files being uploaded. The other wonderful thing is throughout the day, if I do need contact with my scribe, I simply hit record on my watch and request that they contact me regarding a chart I have an issue with, and they'll email me or text me, and that issue is resolved without having to go through a call center tree, a helpline. It is executed usually right then and there on the same day. The other thing is I've had scribes where we have transitioned from one EMR to the next EMR, and that has not proven a problem. We simply get them the training they need, and they carry your preferences forward from one EMR to another EMR. There's been situations where one EMR is used in the outpatient setting, one EMR is used in the hospital setting, and the scribes can be trained and given access to both. All in all, in my time utilizing iScribes over the last 4 years or so, in direct contact, through direct contact with my colleagues and other colleagues, I have yet to find a physician that has left iScribes for any reason for dissatisfaction. If they've left iScribes, it's usually been similar to my experience where they changed employment, and it kind of resets where an employer has to establish a new relationship with the iScribes organization. But in my personal experience, have never had a physician all of a sudden change their mind regarding the value that the product confers. Everybody I knew 4 years ago that started with iScribes is still on iScribes, unless, unfortunately, they have transitioned to, like I said, a different work environment that does not allow them access. All right, and that for the most part concludes my experience with iScribes. I think one more thing I'd like to stress in closing is that someone once asked me, what type of orthopedist do you think iScribes would be right for? And the truth is, and I have no shame in saying it, it's right for everyone, but it is integrated in different ways. It is right for anyone who wants to document in a detailed, ethical manner that produces a quality note instead of a note filled with low-yield, low-value templated content. It is the right product for anyone who wants to increase their quality of life by taking as little work home with them as possible. For anyone who recognizes value in the time relationship with money, it saves time and actually has the potential to increase your revenue. It is, although it uses technology such as iPods and iPods and smartwatches, the technology learning curve approaches zero. You're basically talking about charging a device and one or two buttons on your watch that say play, pause, and stop. Simpler than programming a VCR. And so I think regardless of one's comfort level in technology and utilizing technology, iScribes has found a way to make it simple enough that it's really user-friendly for even the most intimidated individual when it comes to technology. In closing, in my practice, I've seen a clear difference in my patients' appreciation for my time. I've seen a clear difference in their perception of how much time I spend with them. Although truly, if I look at the clock and I look at the recording, my average encounter is still 2 to 5 minutes, but the perception is that I was there longer, in part because of my level of focus. And of course, I examined my patients, and that combination to them has conferred a level of quality and a level of compassion that I simply couldn't get while holding a chart in my hands with a pen, writing down chicken scratch to later dictate into some type of EMR. I've also found that I don't cut corners. When I look at my note, it's of significant value. It says what I wanted it to say, and it said it concisely. When I look at the history of present illness, so much more data is captured there about the context of the patient's injury or medical complaint that I probably would not have included if I was utilizing a voice-to-text solution, but I had a wonderful scribe who captured it and made it objective, and I'm able to connect with my patient in a much closer way because it said, oh, I remember this happened when you said you twisted your ankle hiking in the North Carolina mountains. And honestly, that wouldn't be a level of detail I would have captured before, but is now captured standard and allows me to deliver much more personal care. So overall, in conclusion, I think iScribes has filled a market niche that has yet to be filled by anybody else at the level of quality and consistency that they do, both on the front end with training and training both with the staff that come to the office as well as the scribes they train, as well as on the back end in terms of HIPAA compliance, security, and integration into your EMR. I think it's unparalleled. I encourage you to ask questions and see if it might be right for you in your practice environment, no matter what type of environment that may be. Thank you.